Hello everyone, my name is Haidee Verdeflor. I'm a caregiver student of Filipino Institute. In this video, you are going to learn what catheter is, what are the parts of Foley catheter, how you are going to insert catheter into female and male patient, care for catheter, and how you are going to collect the urine. What is Foley catheter? A Foley catheter is a thin, flexible rubber tube used to drain urine from your bladder when you cannot urinate yourself. On the end of the catheter inside of your bladder is a small balloon filled with water to keep the catheter safe in place. The other hand catheter is connected to urine collection bag. For patient privacy, we need to close the door, close the curtain, and begin the procedure. Hello, ma'am. Good morning. My name is Haidee Verdeflor, and I'm your caregiver for today. Can I hold your desk? What is your name, ma'am? When is your birthday? Okay. I'm going to insert the catheter in your genital area. How are you feeling, ma'am? Are you okay? Okay, let's start. Equipments needed in inserting the Foley catheter into female patient. We have here a basin with soapy water. The other basin is sterilized warm water, 3 towels, 2 gloves, hand sanitizer, drips, kidney dish, Foley catheter, collection bag, and sterilized gel. To start the procedure, sanitize my hand first and put on my gloves. And show the genital area of the patient. Before that, we have to put on underneath the drips first, but I don't have, so I just go directly in cleaning the private area. So get 1 towel, clean towel, and put it in the water or dip into the water with soapy water. Clean the peri area from top to back and use again a new set of towel. Clean the side from top to back and clean the middle from top to back. So after cleaning, you have to discard the gloves and put on a new set of gloves. But while I'm putting on my gloves, you make it sure that you already put the sterile gel into the urethra, so and allow it to absorb or work, so that when you insert the catheter, it's not so it's so easy. So now I'm getting my kidney dish and the Foley catheter, as well as the collection bag. So you have to put on the kidney dish on the middle of the knee of the patient and start inserting the catheter and the urethra, and uh, it's already insert into the collection bag. And then after, you need to inflate the balloon. Make sure that the catheter is inserted properly. and at least 2 to 3 inches until the urine comes out. And next is put the syringe with 10 cc sterile water to inflate the balloon and to prevent the catheter from splitting out from the patient's body. And also, when the catheter is being removed, then the balloon will be deflating. So avoid tagging the catheter and put on the collection bag on the side of the bed of the patient underneath the waist of patient. So attach it on the side of the bed. For the insertion of a catheter into male patient, you need a basin of soapy water and also the sterile warm water. And in cleaning the male patient's private part, you need to pull the foreskin if the patient is uncircumcised, and then start cleaning it into circular motion, one stroke, and then repeat it and rinse with the warm water. And if there's no stain stick on the towel, uh, pat it dry. And then after patting it dry, you start inserting the 10 cc sterilized gel and allow it for a while. And then you can start insert the Foley catheter into the urethra. And then you can inflate the balloon, inject the sterile warm water to inflate the balloon. And if it's already done, you can insert the catheter, I mean the collection bag, and make it sure that it's not tagging the catheter, and then put on the or attach it into the thigh of the patient, and then the collection bag should attach to the side of the bed of the patient that is underneath also the waist of the patient. So now I'm going to clean the catheter itself using the soap and water. You want to work away from the catheter downward at least 3 inches, and you go underneath and rinse it off with warm water, and make sure not to tug on the catheter, and the last towel to pat dry, not to rub. So to start with, I'm going to get the Q-tip with Vaseline and apply it on the catheter on the top, going down at least 2 to 3 inches, and then on the same way also underneath you get another Q-tip and put the small amount of Vaseline and uh, put it on the underneath of the catheter, going down at least 3 inches also. So that's all the compilation of of your catheter care. And once you're done, don't forget to wash your hand and you are all finished. For urine collection, you need to clean the sample port of the catheter with an alcohol swab. Attach, attach the lower lock syringe to the sample port of the catheter and withdraw 10 to 30 ml of urine. And remove the syringe and unclamp the tubing. Open the lid of the sterile container and then transfer the urine to the sterile container. And after that, you're going to close the lid tightly.